When I last reported on Friday, May the 15th, we had, at that point, a total of 406 cases. We're now up to 432 cases. We removed 2 cases because they initially were tested to be indeterminate, and upon follow-up testing were found to be negative, and so they've been removed as cases. So in fact, we've had an additional 28 cases since I last spoke on Friday. We've had, I regret to inform you, 2 additional deaths, and I would like to express my condolences to the family members for your loss. So this makes a total of 34 deaths. Both of these took place at the Owen Hill long-term care facility. One, a female in her 90s who passed away on May the 13th, another, a male in his 60s who passed away on May the 14th. So when we look at our 28 new cases, one is in a long-term care facility or related to a long-term care facility outbreak. That is a staff member at Owen Hill who is presently in self-isolation. So that makes a total of 21 staff who are cases up from 20 before. One thing I would note at this time is that nearly a quarter of all of our cases, making a total of 5 or 24%, are associated with institutional outbreaks. So if we look at our 27 other cases that have occurred since Friday, they range in age from under 10 to in their 80s. 23 of them are self-isolating, 2 are recovered, and 1 is hospitalized at RVH. A man in his 60s from Barrie. 13 acquired their infection in the community, 11 were close contacts of other cases, 2 are under investigation, and 1 had traveled within Canada. 26 are from within Simcoe County, and 1 is under investigation, so we don't have any of them down as being from Muskoka. 40 of all of our cases are newly recovered, so a total of 303 of our cases, or about 70% of our cases, have recovered. If I look at our long-term care facility outbreaks, first off, we've had 1 declared over, and that's Muskoka Traditions. So that remains, we remain with 4 outbreaks at this time, down from 5. And they are as follows: Bradford Valley, which has had no change and is very close to being declared over. Owen Hill Care Community, Bayview Retirement Home, and Collingwood Nursing Home. So Owen Hill, as I've mentioned, have had 2 additional deaths, so they've had a total of 9 deaths. They've had a total of 48 positive test cases, up from 47. So the new cases I indicated is a staff member, so that's 21 staff in total, and no change in the number of resident cases, which is 27. We've tested the facility and have had test results come back, which have been negative apart from the individuals that were found to be cases. Bayview Retirement Home has had no change, so 3 staff cases and 2 resident cases. And Collingwood Nursing Home has had 3 resident cases, which is unchanged. They were initially asymptomatic. One of them has now developed some respiratory symptoms. We've tested the facility. We've had a large number of tests come back negative, but some are still pending. And there are currently no other symptomatic residents or staff from that facility. With regards to our universal testing of staff and residents in all of our long-term care facilities. We were to complete that as of Friday last week, and we did so. So that was a total of 31 long-term care facility locations and 4 retirement homes that had been outbreak, and also 10 emergency childcare centers. So we're happy to say that has been completed with over 7,000 tests that were done related to the universal testing in those locations. I'm going to draw your attention now to our health stats site. I told you on Friday that we would have a new look to it, so I'm happy to walk through that site with you. And I should also say, before I forget, that we are also planning on Friday to put some additional modeling data on this site as well. We've done further projections, and so we would have that available for you to see on Friday. But anyway, when you look at what there is now, there's a lot more that's interactive. There's sort of a hover function, so that if you hover the cursor over some of the content, you'll see more information come up, or you can click on certain parts and you'll get a change in the look of the graph and more information. So more interactive, a drop-down menu for you to sub-select among the data to kind of drill down further about the data. And then there's highlights up at the top. So the highlights are that we've got our confirmed cases of 432 to date, with 70% having recovered, that the incidence in Muskoka is significantly lower than the incidence in Simcoe County, and for the province for that matter. Simcoe County, Simcoe, Muskoka is significantly less than the province's rate overall. The vast majority of our cases are actually in Simcoe County, 95%. The median age of cases that have recovered is 50, compared with the median age of 85 for those who've deceased. 1/4, or 24%, of our cases are associated with local institutional outbreaks, and those who are 80 years or older have the highest incidence and the highest case fatality rate as well. So seniors are being hit much harder by this, as is shown in our data. And in March, travel was the most common means of acquisition. By May, most of the cases were community acquired or outbreak related. So there was certainly a shift over time in how people have acquired COVID-19 in Simcoe, Muskoka, and you can see this in our data. So if you scroll down, there's a table about institutional outbreaks that breaks down the number of outbreaks, the number that are ongoing, the number that are over, the number of cases, the number of deaths for long-term care versus retirement homes versus group homes. We have our epidemiological curve that's been there all along, expressed in the daily case count. But below it is another way to show the data, and that's the cumulative cases. So that goes up. It can only, of course, go up because it's the number of cases that you've accumulated day by day. And if you hover over it, it'll give you the exact figure for each of the bars, as well as highlighting the date for each of the bars. Below that, you'll see what we call the crude incidence and case fatality rates by geographic area. So the incidence in Simcoe, Muskoka versus Simcoe County versus the district versus Ontario, driving home the point that the incidence is much lower in Muskoka than Simcoe County, and in Simcoe County and Muskoka combined, it's much lower than the province. And then we have the case fatality rate, which is the number of deaths per 100 case. And here we see that our case fatality rate is about the same as the provinces. I would say that it looks significantly lower, perhaps in Muskoka versus Simcoe, but otherwise our figures are about the same there. We've got the age-specific incidence, case hospitalization, and case fatality rates by age range. And once again, this drives home the point that those who are older, particularly 80 and older, are more likely to become cases, and also that they're more likely to die from their infection. 35% of our cases 80 and older have been dying from this infection. And then we got a table that provides the type of case categorized by recovered, deceased, hospitalized, or ongoing, not recovered or in hospital, versus the outcome. Here we're looking at sporadic cases versus outbreak cases in residents versus outbreak cases in staff versus total. So once again, give you, I think, a good sort of categorization of the data for you to have a look at. We have a table here about the median age of cases by outcome. So what's the median age or the average age for all cases? And if you hover once again over these points, they give you the exact figures. So the average age for all cases is 53 years of age versus those who've recovered, which is 50, versus the age for hospitalized, the average age is 69, versus the average age for the deceased, which is 85. If you continue on going down, we have cases by gender and by age grouping, and you can see here that there's perhaps a little bit of difference between men and women in terms of how the age distribution plays out. And then we've got the ability to look at how the age plays out for different types of cases. So you can look at it for total cases, but it's got a drop-down menu for sporadic cases, outbreak, for residents and staff, recovered, hospitalized, and deceased. We've got a table about cases by intervention and outcomes, so hospitalized versus active versus recovered versus deceased versus all. And then we've got one that allows you to see how things have changed over time. So it's looking at where the cases acquired their infection, and you can look at it for March, or you can look at it for April, or you can look at it for May, and it demonstrates that in March, they were most likely to acquire it by travel, but by the time you get to May, travel is very infrequent. It's much more likely to be community acquired. So anyway, as this unfolds and we get more information, we do want to make the information more and more useful to the public, to yourselves, to partners, in order to be able to understand what's happening with regards to the pandemic and how it's impacting here in Simcoe, Muskoka. So I'm now going to turn to our media questions. And the first is just some information about this now being the first stage of Ontario's reopening of businesses beginning today. This is all provided by the provincial government via their press releases. So there's a reopening of retail with exterior doors for some outdoor recreational amenities, including outdoor sports facilities and multi-use fields, off-leash dog areas, outdoor picnic sites, benches and shelters in parks and recreational areas. What's remaining closed to date are outdoor playgrounds, play structures and equipment, fitness equipment, public swimming pools, splash pads, and similar outdoor water facilities. Also announced today that Ontario's publicly funded elementary and secondary schools will remain closed for the remainder of the present school year, going into the summer. I had heard verbal communication about summer school being something that would be open, but we don't have more details about that. There is the expectation that all the students would be on track for graduation. Private schools are also to be closed, remain closed. Licensed child care centers and early on programs will also remain closed, but emergency child care will continue to operate and provide support for health care and other frontline workers. A gradual reopening of child care is expected to begin within the province when it's ready for transition to stage 2 based on public health criteria, which include robust safety protocols to protect Ontario's youngest learners. And day camps will be able to operate within stage 2 under the same criteria as, so I'm just not quite getting the note that I've got here, but I do know that the overnight camps are not to be open this summer. So the day camps, they would be looking to open them up with safety provisions, but the overnight camps will not be open, that the hazard has been deemed to be too great. We've had, from time to time, questions about the use of masks, and I was told that there was some concern that some people have been seeking to buy N95 masks for their own protection. So at this point in time, we continue to support the position of the Chief Public Health Officer, Dr. Theresa Tam, which is that healthcare masks, which include N95 masks, surgical masks, and procedure masks, should be safeguarded for use by people in healthcare, because there is a shortage of these masks, and those environments are such that people need protection when they work in those environments. For the benefit both of staff but also of patients. And therefore, when it comes to masks in the community, the recommendation is that people have to continue to exercise the physical distancing, the 2-meter setback. They need to continue to doing frequent hand washing and avoiding crowds. And if they develop symptoms, self-isolating and seek assessment and testing. And that the use of a cloth mask, a homemade mask, may be beneficial to prevent the wearer from possibly infecting other people in an environment where they cannot maintain that physical distancing of 2 meters. It's not been shown to be beneficial to protect the wearer from other people, but it may be beneficial in reducing the spread from the wearer to other people, noting that COVID-19 can be spread asymptomatically. You can have people that have the infection and don't develop symptoms, or they develop symptoms later, but for 48 hours preceding their symptoms, they're still infectious. And so wearing a mask like that, if you are in an environment where you can't maintain that 2-meter setback, can be beneficial from that point of view. Such environments might very well mean public transit, or perhaps certain work environments. Perhaps certain retail environments, though I've seen that retailers have put in place a lot of measures to allow people the setback of 2 meters. And that people can't be complacent about it. A mask doesn't in any way take away from the need for physical distancing. And people have to maintain that physical distancing of the 2 meters and the hand washing, even if they're wearing a mask, and they need to be careful about contaminating their hands and potentially infecting themselves while handling the mask as well. If you go to our website, you'll see information about masks that'll help with all of this. So I've already spoken to the changes on our health stats page and the fact that we're going to be having some more information about modeling and future projections coming up on Friday. So some notes and media questions. On Friday, there was some discussion, some questions about the reproductive number and the fact that if it's above 1, then the pandemic will continue to grow, and if it's below 1, then it will shrink and eventually come to an end. And that we had projections that showed in late March and early April, we had a high R0, almost 2 in Simcoe, Muskoka, and you'll just have to excuse me for a moment. Okay. And so the question that came up was, well, what is the R0 now in Simcoe, Muskoka, the reproductive number, what is it in Ontario? What I said was I knew that for Ontario it was just below 1, it was 0.9, and that I needed to look into whether we had a figure for Simcoe, Muskoka. And so we do have a figure. For the week of April the 30th to May the 8th, the reproductive number hovered around 1. The actual figure was slightly below 1, but with our confidence interval about stability of numbers, it included 1. So if you have it around 1, that means that it's kind of a steady state. It's not declining, it's not going up, and that would be consistent with what I'd observed before, that our data was showing that in the preceding 3 weeks, we'd had a slight increase in our weekly incidence of cases. We'd like to say that we got some positive news on that front, that the number of cases last week actually went down compared to the week before. So the week before we had 73 cases versus last week 53 cases. That's very good news. That when we calculate our incidence, it'll show that it's come down, and I dare say that that would also be reflected in our doubling time, which is another measurement that we use to gauge whether or not the pandemic is coming under control or not. We had a question on Friday about the number of our cases that were healthcare workers and the number of these associated with our outbreaks. And at that time, I had reflected that about a quarter of our, off the top of my head, a quarter of our cases were healthcare workers. So I have more detail for you, including, I think, a learning for myself. So as of May the 15th, 90 of our cases are healthcare workers, which makes 22% of our total cases. And of these, 34, which makes up 38%, are associated with institutional outbreaks in Simcoe, Muskoka, and another 31, which makes up 34% of all of our cases, of all of our healthcare worker cases, are associated with institutional outbreaks in other jurisdictions outside of Simcoe, Muskoka. So the remainder, 25 of our healthcare workers, or 28% of our healthcare workers who are cases, are sporadic cases not associated with an outbreak. So that was actually new information for me. I didn't realize that we had that other wedge of healthcare worker cases associated with outbreaks outside of our district. I think that's an important takeaway, that it would appear that the great majority of our healthcare worker cases are actually associated with outbreaks, that it would appear that they became cases because of their work environment. So there was also a question about our expected mortality in Simcoe, Muskoka from our first model compared with our actual mortality. And it was noted correctly by the reporter who raised this, that our last model predicted that we'd have up to 20 deaths in Simcoe, Muskoka. And when we look at our model, when I look back at the model, indeed it predicted that we could have between 15 and 20 deaths that would occur by the end of April. And that's an important distinction. And so when we look back at our data, I reported on May 1st that we had 20 deaths that had occurred versus the 15 to 20 that had been predicted by the end of April. So it would appear that there was good agreement between what our model predicted and what had actually happened. Of course, since that time, we've had additional deaths, but the model was making the prediction up to the end of April. Okay, so at this point, I would be happy to take questions.
Thank you, Dr. Gardner. Chris Simon from the Very Advanced. You have a question for Dr. Gardner?
Yes, of course. Thank you very much. I just noticed that the long-term care cases, there were none over for the weekend, obviously a couple of deaths, and then the one healthcare worker. But in terms of residents, it really seems to have slowed. Have we rounded a corner?
I hope so. I agree with you about the interpretation of the data. It looks very positive, and I touch wood because things happen for a reason. Things improve because of actions taken. The control measures that we put in place together, the whole healthcare system, these facilities themselves, the testing that we've been doing. But it appears that things are improving quite substantially. And this would be consistent with the data that we see across the province as well, that the number of long-term care facility cases peaked and is coming down.
And another question, just curious to know whether the health unit has any clue as to whether or not the homeless or vulnerable population of the region have been hit or affected by COVID-19 in any way.
Thank you for that question. We're well aware of the homeless shelters and how they're managing COVID-19. We were intimately involved with their planning, advising, preparations. The great majority of them were actually moved into hotel rooms in order to provide better spacing for themselves to avoid the likelihood of infection transmission, likelihood of an outbreak. And we've not seen any test positive cases to date associated with any of those that were in group homes. So that's not to say that we don't have any cases among people who are challenged for their housing arrangements, but there have been no cases associated with the homeless shelters.
May I ask whether there's been any type of testing, regular testing or anything like that, like there has been with long-term care facilities?
What's in place is surveillance. So the operators of those shelters have been carrying out close surveillance and have kept us informed of any concerns that they have, but we have not been testing asymptomatic people in the shelters. We've only been testing asymptomatic people in the long-term care facilities because of direction from the province.
Thank you.
You're welcome.
Thank you, Chris. Erica Engel from Collingwood Today. Do you have a question?
Yes, I do. Dr. Gardner, do you have any modeling projections for the month of May already done? Specifically, are you expecting the same number of deaths in May as you were in April?
I don't have projections with numbers for May, no. Our initial model, it did two or three things. It gave us projections through the month of April, and then it gave us projections over a 2-year period with different sorts of scenarios, like the worst case scenario where you don't intervene versus the kind of control measures that we put in place, and looked at what would happen if you stop those control measures. And basically what it showed is that when you stop them, you get a large spike of cases, and so you have to keep them up either continuously or intermittently. And that by doing so, you can reduce the number of cases and then the amount of death by about 95%. But no, it did not actually give numbers for the month of May.
Okay, and then further to the universal testing, did I hear something you're moving on to retirement homes now that long-term care homes have been tested?
So we've not decided at this time to go ahead and test all residents and all staff in the retirement homes or in other congregate settings such as group homes. If the province directs us to do so, we certainly will. We do have an approach in place for these congregate settings, as we call them, and it involves a close monitoring of what's happening with them, review of their infection control practices and just how vulnerable they are, the surveillance to detect any cases, and certainly if there's any symptoms at all, anybody with any symptoms, then a testing of those with symptoms, and if we get any cases at all, then a testing of the entire facility. But at this point, we aren't planning on testing all staff and all residents in all of those facilities.
Okay, and just one more quick question. The facilities, the long-term care facilities that have already been done through universal testing, what would trigger further testing at those facilities? Are you waiting for symptoms at this point?
Yes, if there's any indication that they've got an outbreak, then we would test them again. And certainly there is in place strong surveillance mechanisms for those facilities, and us communicating with them on an ongoing basis, and addressing infection control issues that they may have through the assessments that we did with the teams that involved partner hospitals and paramedicine. So trying to take an approach of prevention through improving conditions and addressing shortcomings and issues, and watching closely for any cases, and if indeed we see any symptoms, testing those individuals and those they've been in touch with, and if there's anything that comes back positive, then testing the entire facility.
Okay, thank you. Dawn Huddlestone from the Huntsville Docker. Do you have a question for Dr. Gardner?
I do, thank you. Just a quick one. On Friday, Dr. Gardner, you said that there was one staff member remaining to be, or that you were still awaiting test results for from Chartwell. I'm assuming now that it's been declared out of outbreak that that's come back negative?
I am sure that it is, though I didn't actually, let me just have a look at my data. It would be a natural thing for us to want to have that back before we declare it over. And all have come back and are negative.
Wonderful, thank you. Okay, thank you. Nathan Schubert from Moosehead, do you have a question for Dr. Gardner?
Yes, I do. Good afternoon. Dr. Gardner, I apologize if you already answered this type of question, but do you feel that we have a good grasp on the COVID situation to effectively open up businesses, and why?
I think it's a calculated risk. Unfortunately, in the circumstances of a COVID world in which we're going to have to deal with this virus until we can bring it under control with a vaccine, which is going to take us late into next year, by all accounts. We're going to have to make trade-off risks. I think we've got a relatively low incidence of COVID-19 compared with the Toronto area, and so that would stand us better. But it could all come back if we're not careful. You can have a relatively low level of circulation, and still, if we collectively aren't careful about physical distancing and about the hand washing and about careful business practices, then it can take off again. It would just start to surge again. We know that from our modeling that that's what it will do. So it's a calculated risk. I think at some point we have to make calculated risks like that, because we have to be able to have an economy that takes care of ourselves and provides what we need. And everybody will want more in the way of quality of life for their overall health and well-being. So the ability to get out and be active and have more of a social life, social interaction is also very important for our health. So we have to make these trade-off decisions and then watch very, very carefully to see if they're having a negative impact on disease, whether we're watch whether surveillance to see if in fact it's starting to take off again. And if that's the case, then we would have to start putting in place more of these restrictions again. So in no way could I say that it's absolutely safe. It is a calculated risk.
Okay. And my second question is, several weeks ago, the situation was being described as the peak of the COVID situation. Would you say we are starting to see a decline, or are we still kind of looking in the peak period?
So if you look at the provincial data, overall, they're definitely the province definitely is on the decline. Fewer cases. If you look at their epi curve, there's a peak and then a decline. The reproductive number is less than 1 for the province as a whole. If you look at the Greater Toronto Area, they've still got a high concentration of cases. and still a fairly heavy impact on their hospitals. So there'd be some concern, I think, in that part of the province, and we shall see how things play out there. And if you look here, I would say that we've got the lower incidence. We have had a plateau or a slight increase in our incidence over the last 3 weeks. I did speak to the data from the last 2 weeks now, last week versus the week before, that was more favorable. A decline to 53 cases versus 73 the week before, so that's a positive sign. But by no means could we say that it's over. I think it's back to that calculated risk. There is still some circulation of this virus. We still, even if we open things up, have to do it in a very careful way.
Thank you.
You're welcome.
Thank you, Nathan. Mike Arsoides from CTP, do you have a question for Dr. Gardner? Are you there, Mike?
Yes, I am. Sorry, I was just doing my stand-up here. Doctor, welcome back. I got a question for you with regard to how wide that net appears to be for keeping track right now of individuals who may have been infected or exposed. Because we got 8 or 11 of those new cases from New Tecumseh. That seems like individuals who have been exposed to one another. How wide is the net right now, people under surveillance across Simcoe, Muskoka?
Well, I think that the key to that is people having access to testing. And we've set up, I think it's 7, if I recall correctly, assessment centers throughout Simcoe, Muskoka. There are still people who would like, I understand there's some people who would like to be able to get tested and don't have transportation, or they are housebound. And so I think we need to look at how do you facilitate testing for everybody, overcome some barriers for people. We have to look at how do we continue to offer testing in the future. Is it going to be through these assessment centers, or is it going to be some other model? Is it going to be through primary care practitioners or something else? So given that we have this as a problem late into next year, that's a long time, and I'm sure that our approach is going to change over time because things don't stay the same forever. We put together those assessment centers in a rush, collaboration with primary care and hospitals to be able to do it. Now is the time to revise what we do to make it optimal, to be able to make sure that the net is wide, as you say, so that people can get tested, and therefore we can know about the individual cases to help them be in isolation, know about their contacts, but also just have this surveillance data to know how much circulation is actually happening in the community, to know how well we're controlling the pandemic.
Do we know how many people currently are under surveillance? Are there more than 1,500 people across the scope that are being tracked by the LPA?
I don't offhand have the data about how many cases we're presently following, cases and contacts, but I can certainly get that information and provide it to you.
And just off basically this long weekend here, as people coming up and going up, it didn't look like there was that volume that we had feared, but based on reports you're hearing from those communities and those healthcare providers, what was the exposure risk? Was it low this weekend as a result of travelers from the city coming up?
So, according to media reports that I followed, it looked like people's migration to their cottages or to cottage country was unusually low compared with a Victoria Day weekend of the past. And perhaps the weather helped because it was a little cool, though not unpleasant. But from what I had heard in cottage country and on Wasaga Beach, that the beach, there were very few people on it, that there was an unusually low number of people in the communities up in Muskoka, shopping, etc. So it would appear that people perhaps heeded the recommendation to stay at their primary residence, which is a very good thing. I think that would have helped reduce the risk with regards to local transmission.
Would that advice continue going forward here? As you know, we're having a great day. We're going to probably see 20s to maybe even 30 in the next week or two here in terms of temperature values. Would you say remain physically distant, remain in isolation, and avoid those places where you could possibly be exposed? Or would you, like you said earlier, calculated risk, make your own determination based on your own situation?
Well, I think we need to strike a balance that is workable for us. So I have no doubt that throughout the pandemic, until it is truly over, there will be the need for some physical distancing, that there will still be the recommendations or even requirements for restrictions in the number of people that you're in intimate contact with, that you'll need to maintain that 2-meter setback, and you'll need to maintain the hand washing and the avoidance of large crowds. I think what's easing up is the sense that you shouldn't go out at all, and I think it's a good thing that people can go out and be more physically active and have some exposure to green space and improve the quality of their lives and their mental health that way. It's just that they're going to have to continue to do it with the physical distancing from other people. We may see this idea of an extension of the social bubble, that what may come in the near future is an announcement that you can include more people that you're intimately in contact with than your immediate household, but that remains to be announced, so I'll have to wait for that. I have no doubt that there'll be the easing up of some other restrictions. We've seen how certain park locations are now allowed. I think we'll eventually get to the point where playground use would be allowed, probably with a recommendation of that physical distancing, though. We'll take it one step at a time. And all of it would be dependent on the outcomes of the epidemiology, the monitoring of cases, and looking for the potential for it to start to get out of control and the increase in transmission again.
Thanks, Doctor.
Okay, thank you. Ian McLennan from Barrie 360, you have a question?
Thank you. Dr. Gardner, the number of tests, COVID-19 tests that were completed on Monday plummeted. I think it was just over 5,800, less than 10,000 on Sunday. The government's saying that you should be able to complete at least 20,000 tests per day. A couple weeks ago, he did a finger wag at some health units. I'm just wondering what your take is, or why the sudden drop in tests per day, new tests per day.
So I think a good number of the tests that have been occurring over the last 2 weeks were due to the push for us to be testing all residents and all staff of all long-term care facilities. That was like 100,000 people, like a very large number of people that had to be tested via that means. And when that stops, you've got a reduction in demand right there, a substantial reduction in demand for testing. And the only way that you would overcome that or have it made up is if there's something else that replaces it. And I think you really need to go to, where do we go from here with testing? And that testing is only a part of your control measures. Where do we go overall with control measures? So testing is important. Certainly people with symptoms need to be tested. The province has indicated now that all people with even one symptom should seek testing. I've certainly supported that now for a long time. Over a month I've been saying that publicly, and would continue to promote that in our communities. My understanding is that despite that positioning from the province, there hasn't been a big uptake from the population. And I guess I would go back to you've got a falling incidence of infections right now across the province. Perhaps the demand in part is related to a reduction in cases themselves, right? So if you're not now testing a bunch of long-term care facilities because you've completed that and you're potentially having reduced cases, then I think it'd be fairly natural that the demand for testing has gone down. We might see some demand go up if we get more cases related to opening up the economy and opening up work environments and get more transmission happening. Certainly we want the capacity of the system to be able to do that additional testing if that happens, because we would want to know about it. We would want those people to know that they're a case, know their status, and have us follow up with them. So it's very important we have that capacity. And it may be that the province would come up with more recommendations or requirements for us. They might require us to test the other congregate settings. They might require us to do more liberal testing, perhaps related to work environments opening up. There might be recommendations or requirements for a sort of sentinel testing system where we're randomly testing asymptomatic individuals as a form of monitoring for asymptomatic transmission. But I think the bottom line is at this point we finished with a big demand of testing in long-term care, and that is finished, and there isn't that demand on the system right now for testing.
Thank you very much.
You're welcome.
Thank you, Ian. Mandy Webster from Rogers, do you have a question?
Yeah, I just have a quick question, Dr. Gardner. I want to go back to, I believe you said at the beginning that you have been testing childcare facilities.
Mm-hmm.
Did you finish those?
We did, yes. We did.
How many facilities were tested?
There were a total of 5 emergency childcare centers.
And were they all within Simcoe County?
They were in Simcoe, Muskoka.
Simcoe, Muskoka. Any positive results from any of those facilities?
No, none that have come back. Remember that we've just completed it. So there's a backlog of all, the over 7,000 tests, right? It's going to take a while before we get those results.
And you said you had just completed those on Friday, all
Yes.
the testing.
Yes.
Awesome. Okay, thank you.
You're welcome.
Thank you, Mandy. Is there anyone on the line that we may have missed?
Yeah, Doug Cross here.
Okay, go ahead, Doug.
Oh, so, we're talking about getting the economy restarted and taking baby steps and all that. But what is the one industry that sort of has you sucking in your breath, Dr. Gardner, that you feel like is the highest risk?
That's a very good question. We are aware of some very large employers, and I won't use names, but they can have very large numbers of people coming together to work. And I think that we need to be, we're advising them about how they can operate. And clearly they want to operate in a very safe way that safeguards their staff and avoids cases and allows for them to be detected early and avoids transmission to others. But just the sheer numbers alone, they would be vulnerable. And we've seen in the food industry, and in particular slaughterhouses, the meat packing industry, very large outbreaks in other provinces and in the United States, where almost half the employees become cases, and they could even have some deaths. So clearly we desperately don't want that to happen. And therefore we want to be working really closely with those facilities to do all that we can and all that they can to avoid something like that happening.
Okay, that's all for me. Thank you very much.
You're welcome.
Thank you, Doug. Is there anyone else on the line that we may have missed?
Hi, Kathy. It's Erica again. Can I ask a question for Barry today?
Sure, Erica again.
Okay, thanks. There are some churches in the Simcoe area that have been petitioning the provincial government to allow them to open in June to have services. I think they're proposing something like 40% of the building's capacity and using hand sanitizer and wiping down surfaces and that sort of thing. I just wondered what your thoughts are on that idea.
Well, I noted that the Premier had just announced today that they were going to allow drive-in church services. So people could congregate, I guess, in a field or a parking lot in their vehicles, 2 meters apart, only household members within each vehicle, and they're not allowed to leave the vehicle, and those that are operating the service can have no more than 5 people doing so, and that they have to be 2 meters apart. So that would be a concession that the province has made. Other than that, of course, services are happening via remote means, internet-based means, and I would imagine that churches are looking at how they can offer supports and services to their membership at this time through remote means otherwise. I think in the end, the province is certainly looking very closely at questions such as this, but they're going to be challenged with institutions in which you bring people together. They would have to be exceedingly careful about the potential for vulnerable people like seniors coming together, being in a confined environment, like the entrance and the exit, and the sort of gathering locations within these premises, about the risks inherent with religious practices or singing, for example. If you sing, you're expelling out potentially aerosol that can travel more than the 2 meters, so they have to be aware of that type of thing. They'd have to be looking at, like you say, hand sanitizing. They have to be looking at the question of whether or not masks would be needed. So there's a lot of work that the province would need to do before they could get to the point that they would allow that, and even then it would be with major concessions.
Thanks very much.
You're welcome.
Okay. Thank you very much, everyone. We will see you again on Friday.
Goodbye, everybody.
Bye.